UNLV Microcertificate Economics. Let's talk healthcare. The U.S. spends more of its GDP. We spend about $1 in every $6 spent in the United States is spent on healthcare. Though, interestingly, half of that money is spent by 5% of the population, and half of that money is spent by 95% of the population. And yet, at best, our outcomes aren't any better, and in some ways, our outcomes are worse. For example, neonatal and postnatal mortality, children who die in the first year, we're more like Jamaica than we are like European countries, Germany, Sweden, Japan. Part of that difference in outcome is about socioeconomic categories: poor, rich, black, white. Black folks in the United States have neonatal infant mortality rates more like African countries, where white folks have the same ones as European countries. If we take it more by income group, we get the same thing. People fully in the system, people who have money, have great outcomes, or at least comparable outcomes. Poor people in the United States have very poor outcomes. Part of that is the lack of insurance coverage in the United States. We have less insurance company coverage than Estonia and Turkey. Costs of procedures in the United States are also much more expensive than in other countries. And interestingly, they vary widely, not just between different parts of the country, but even in the same city, you might get wildly divergent costs of doing exactly the same thing. So why is that? I'm not going to claim we know all of it or that I'm going to explain all of it, but let's talk about some basic ideas. What does it take for markets to work? First, we need competition in the marketplace, right? Fundamental, Adam Smith, competition, lots of buyers, not 2 or 3 or 4, lots. And the consumers who are going to make the decisions have to have good information sufficient for them to make the best choice. Then the system has to have positive incentives. It has to have incentives to do whatever we think the right thing is. And we might not even agree on what the right thing is here. And lastly, we want the system to be efficient. And the question is, how are we going to measure efficiency in a healthcare system? We talked about concentration once before, and here we have a chart that uses something called the HHI, which is the Herfindahl-Hirschman Index, which the government uses to measure how concentrated an industry is. It's a nonlinear measure. An unconcentrated industry, a competitive industry, might have an HHI of 50, 100, maybe even 20. Monopoly is 10,000. So what do we get? Well, primary care physicians is 2,000. The government considers that to be high concentration. Extreme concentration, insurers, specialist physicians, and hospitals, most of the way to being a monopoly. So we have huge market concentration in the healthcare system. It is in no way competitive. No segment of the healthcare industry is a competitive market. We have a very small number of acute care hospital beds. We're actually 80th in the world in the number of acute care hospital beds we have per every 1,000 population. Japan has 3 times what we do. Germany has more than twice what we do. And again, we have fewer practicing physicians per 1,000 people than most countries or most developed countries do. And here is more by state. You can see there are big parts of the United States where we have fewer than 3 doctors per 1,000 people. We have a few states that are 4 doctors, one that's 5. Most of Europe is 4 and 5 physicians per person. Nevada not doing very well there. One way to compensate for this is to use physician's assistants or nurse practitioners to work with the physician. They can see most patients. They can see the simple cases. But you'll notice that some of the places where they don't have a lot of doctors, they use a lot of PAs and nurse practitioners. But in places like Nevada, we don't. In California, they don't. These are ways to expand healthcare without making it very expensive. What does all this mean? Well, if we don't have enough caregivers, if we don't have enough hospital beds, you're not going to spend as much time with your caregivers. It's going to be hard to make an appointment. You might end up at urgent care because you can't get in to see your primary care. You might not be able to talk to them about some issue that's going on with you. Your care might not be what it should be. And if you don't have enough hospital beds when you get a pandemic, now you have issues, right, that we've seen over the last couple years of them having to put together makeshift operations and maxing out and running out of doctors and running out of nurses at the hospitals. Not having enough hospital beds, doctors, nurses, that's going to make the price of healthcare go up. Supply is down, price goes up. Beyond that, we don't generally have information about what something's going to cost before it happens. We get surprise billing, it's called. They're trying to stop that, supposedly, but we used to have a professor at UNLV who developed the hospital billing system for one of the hospitals in town years ago, and they intentionally put in his contract that they wanted it to be hard to understand for the customer. And they loved the system that he put in because it was impossible for the customer to understand what he was talking about in their bill. We may not be able to pick different hospitals, and we certainly can't call around to different hospitals and ask them what they would charge us to do something. Our insurance company is likely to send us to one place and expect us to go there, or our physician may send us to one place. Once they've got you, they can charge you $50 for an aspirin because you don't have any choice. You also might not know if it's even the best treatment for you. Your insurance company might limit your physician to offering certain treatments, or you might have picked the most expensive treatment. I had a physician who wanted to do something to me, and I kept saying, that's not what I have, because I went and I read the medical literature, and I went like, that's not what I have. And so he said, well, I can run this test. It's cost you $1,000. I said, run the test. Well, we ran the test, and it came back, and it's had what I was right, and he was wrong. And he wanted to spend $20,000 cutting something. And, right, if I didn't have a PhD and didn't read the medical literature, maybe I'd be walking around with a hole in me that I didn't need, right? And it turns out that the procedure he wanted to do is very commonly done, and according to the American Medical Association, way too frequently done. But most people can't figure out on their own, and they have to trust their physician. I can't shop around for the best deal. I'm limited. I fired that one doctor, but my choices for hiring a new doctor were about 3. So we don't get the option usually, even though you have lots of choices. Your choices may actually be way more limited than you think they are, and that's going to affect your ability to optimize your health care. Let's compare health care to taking your car in. If I take my car into the shop, they are required by law to give me an estimate, and I can get estimates from as many shops as I want. The law in Nevada says they can't deviate by more than 10% from the estimate without your permission. It says in law, again, that I have a warranty on that generally, and if it turns out that they made a mistake, they have to correct that at their expense, not at my expense. And yet my health care doesn't seem to work like that. I can't shop around. I don't get an estimate. They can deviate from that estimate all they want. And if they make a mistake, you might end up getting billed for it, right? Or the surgery doesn't go well and your bill goes up and up and up and up and you don't know what's going on, right? My mom had the flu. She was old. They sent her to the hospital just to get some fluids and stuff. And her hospital ran $10,000 in tests that she found out about it when she actually asked for the bill. She had the flu. Everybody knew she had the flu, but they ran $10,000 in tests, probably to rip off Medicare, right? And the system is, right? Just is that way. What happens then is we're going to transfer a lot of the responsibility essentially to hold the system accountable. We're going to transfer that to the attorneys and the courts rather than the entities, the competition, the invisible hand, working to try to make the system efficient, effective, all these other things. And we make the lawyers rich and not necessarily make the patients better off. As a patient, what incentives do I have? Well, maybe you have a large deductible and your incentive is not to get treatment or not to go unless you have to. Maybe you can't afford your child's medication. Maybe you can't afford, right? Or maybe you're rich and your incentive is to go get lots of treatment, whatever you need. Or I used to think my parents thought of their physician as part of their social life, and they knew all the nurses and the people that worked at the counter, and they were always seemed to be going to the doctor for something, and it just felt like they were using that as part of their social life because it didn't cost them much of anything. Again, what do I do? How do I change this if I don't have insurance? So if I can go to my physician and it costs me $20 to go and then they're going to bill me, but I have an account that the state gives me with cash in it and I can pay that bill, so it basically is not going to cost me. My healthcare is going to be free for the year. My behavior is going to be different than if I don't have insurance. If I don't have insurance, maybe I'm going to the emergency room when I have an emergency and not going to the doctor. Maybe if I'm pregnant, and I'm obviously not going to get pregnant, but maybe a pregnant woman's not going to get any prenatal care, which would be very helpful and might help prevent or catch issues that are going to cost a lot of money later on. Maybe she's going to get those done. Insurance, if we know and understand how to use our insurance well, should help us create better outcomes. But again, what happens? Who does what? Who knows what? What's the information here in the system? And what's the goal of the system? Do I understand my system? And I just mentioned this, but I want to talk about it again. I have something called a health savings account through my system. I have a huge deductible. I have a $1,500 deductible. But I get hundreds of dollars every year that goes into this health savings account. It's pre-tax, so I'm not taxed on this money the same way. I can invest it. It can grow. I can put more in than the state puts in. It has tax advantages when I do that. I can build it up. I can use it to pay my medical bills. But I understand my system, where I'm sure that lots of people out there don't understand how to use the system right. And is the system going to teach them how to use it right? Probably not. I'm a hospital. I spend millions of dollars buying a piece of equipment, this MRI. I don't want it to sit there. I'm going to encourage doctors to make people go get scanned, and I'm going to make sure the cost of that scan is high enough to cover the cost of the machine. We might have, because again, we have this market that's controlled, maybe we have too many of these machines out there, and the entities that are using them too often, charging too high, right? The optimal thing that a competitive business does is different than the optimal thing that a business is going to do if it doesn't have competition. If essentially it's taken you in, once you're there, it's a monopoly, they will act differently than they would if this was a competitive market. If I'm a drug company, what are my incentives? Well, I don't want to make a vaccine. I don't want to get $20 for something to stick somebody in somebody's arm and they never get sick. I don't want to give you a pill that cures it. The best thing in the world is that I give you some treatment that you have to take for the rest of your life. Right? So the things that we probably need a lot more of, which are vaccines, and I know there's this whole vaccine debate, but science, the thing we need more of is vaccines. We need more different kinds of vaccines. Cheap, effective, keeps people healthy. We need cheap, effective cures for things. We're not developing new antibiotics when our old antibiotics are becoming less and less useful. We're not developing vaccines when our old antibiotics are becoming less and less useful. We're not doing the things that we need to do for the future because that's not where the profit in the system is. Curing baldness would be a much more profitable thing for a drug company than finding a cure for, or a new antibiotic. Finding a cure for AIDS would cost the drug companies a lot of money because AIDS patients get to use these very expensive treatments for the rest of their lives. The wrong incentives are probably in place for the drug companies. And what's the most important thing here, right? What are the goals of our system? Is the goal of our system for the healthcare companies to make profits? Is the goal of our system to have the best possible patient outcomes? Is the goal of our system to have positive patient satisfaction? Europeans, Canadians, they like their healthcare systems more than Americans like our healthcare system in general. So is that what we want? Do we want the patients to be happy? Do we want to get our costs down? Do we want to stop the 17% we've got and turn it into the 8 or 9% that most countries in Europe have? What's our goal for the system? And if we can't agree on what the goal is, we're never going to agree on what we need to do to make the system work better. Measuring efficiency in healthcare is hard. What is it? Is it costs? Is it outcomes? What is an efficient healthcare system? And how do we know it if we have one or we don't have one? This is something that makes for great discussions. No matter how we do this, no matter what we want to think about, how healthcare works, what makes a good healthcare system, who's entitled to it? Is anyone entitled to healthcare? Is that this is such a great topic to have discussions and talk about the economics of something that all kinds of different economic issues pop up every time you turn around.